Hey everybody, and welcome to the next edition of the Soccer Fitness Goals video blog. Today on the blog we're going to be talking about Osgoode Schlatter's disease, which is a common injury that affects lots of young soccer players as they're growing, how to manage it through exercise and other modalities. So Osgoode Schlatter's disease is a more severe case of tendinitis of the tibial tuberosity. And if that sounds complicated, it doesn't need to. The tibial tuberosity is basically just the point on your knee where the patellar tendon, which is the tendon that is the insertion point for the big quadricep muscle in the leg. The tibial tuberosity is the point on the knee where that patellar tendon inserts, and the movement that it does is to extend or straighten the knee by pulling on the tibia, which is the big shin bone. This is a common movement that happens in everyday life, and of course it's also a common movement in soccer. So tendinitis of the patellar tendon is just a word that stands for inflammation of that tendon. And the tendon can get inflamed in a variety of ways. Soccer is a prime example where there are lots of movements where players are decelerating or slowing down, cutting, jumping and landing from jumps, and even the act of kicking the ball. Because all of those movements involve straightening of the knee and thus involve the tendon pulling on the tibia, over time repetitive movements like that can cause inflammation or tendinitis on the patellar tendon. So Osgoode Schlatter's disease specifically is a condition that affects youth athletes and youth soccer players while they're going through their growth spurt. And it's a more severe form of patellar tendinitis that flares up or acts up during the growth spurt. And the reason for this flare-up is because during the growth spurt, the tibia or shin bone becomes a lot longer. And so the tendon, which has to pull on that bone, ends up in a very short period of time having to pull on the tibia or pull on that bone, which becomes 3 or 4 inches longer very quickly. The tendon at the time may not be strong enough or may not have adapted well enough, and as a result, the tendon has to work very hard and it becomes inflamed. So the inflammation to the patellar tendon and the associated pain that comes from patellar tendinitis and Osgoode Schlatter's disease in young athletes and young soccer players can be just a discomfort, or it can be more severe pain that limits or even prevents physical activity altogether. Management of this condition in youth soccer players is really important because limiting activity for long periods of time will lead to decreased levels of fitness, and no soccer player wants to lose their fitness because of inactivity. So the two main ways that you can manage the pain and the lack of activity associated with Osgoode Schlatter's disease are, one, to use modalities like this Chopat strap, and two, to use exercises. So we're going to talk first about the Chopat strap. It's a simple strap with some rubber padding on the inside, and the strap is placed along the front of the knee so that it's touching or in contact with the patellar tendon. It should be strapped up fairly tight, not to the point at which circulation is cut off, but to the point at which there is some pressure and compression applied to that tendon. As a result of this pressure and compression applied to the tendon doesn't have to work as hard when it's pulling on the tibia. As a result of that and the decreased loading, there will be decreased pain and increased mobility in the knee, even in a severe case of Osgoode Schlatter's disease. So in addition to the use of the Chopat strap to manage the pain associated with Osgoode Schlatter's disease, another good way to both manage pain and increase mobility and physical activity in the knee is to use eccentric leg strengthening, and specifically eccentric leg strengthening for the quadriceps muscle, which is the big muscle in the front of the thigh. Eccentric strengthening basically just involves making the muscle contract and contract using resistance, but contract while it's lengthening as opposed to while it's shortening. And I'm going to show you a few examples of how you can do that. So one simple exercise that can help with eccentric strengthening of the quadricep muscle and the patellar tendon is a slow step down. Use a height of a step that's reasonable based on your leg strength. Step up with a regular speed, and then as you are lowering yourself back to the floor in the step down motion, do it very slowly. Try to take about 4 to 5 seconds, and the leg that's stepping down, the toe of that foot should just tap the ground so there's no weight shift. All of the weight stays on the leg that's pushing yourself back up, and then you push yourself back up again at a normal speed and repeat the movement. So the quadriceps and patellar tendon can be strengthened eccentrically but also isometrically. The muscular contraction in an isometric movement involves tensing the muscle or using resistance on the muscle where there is no change in length at all. And one good example of that is a isometric knee extension using a stability ball. Sit on a chair or a box close to a wall and place your toe around the middle of the stability ball with your knee starting at a 90-degree angle. Push or kick into the ball, trying to straighten your knee, and the ball will provide resistance for you. Hold that contraction for about 5 seconds, and then rest for 5 seconds before repeating the movement again. So although Osgoode Schlatter's disease is an injury which affects millions of young athletes and young soccer players while they're going through their growth spurt, if these athletes and players use a combination of the Chopat strap as well as eccentric and isometric leg strengthening of the quadriceps and patellar tendon, they can manage and limit the pain as well as limit or even eliminate completely any time off that they may need to take from training and games. So thank you all for watching this edition of the Soccer Fitness Goals video blog. I hope you enjoyed it. And as always, if you'd like more information, you can visit www.soccerfitness.ca or www.soccerfitnessgoals.com.